everyone, and welcome to this webinar. Good morning and welcome, or good morning, good afternoon, depending on where you are. My name is Patty Fallon, and I'm an account manager on our advisory services team here at Ipsos. I'd like to thank you all for taking the time to join our webinar, where we'll be exploring telemedicine and shifting paradigms in healthcare. Our session today is being led by two of our top experts, Nimit Bansal and Alex Colborn. Nimit is a vice president with our advisory services team, and Alex, also with our advisory services team, is an account manager. You can read more about Nimit and Alex in their biographies here. And additionally, you can reference the handout section in your event console for an overview of our further insights about telemedicine. Today's presentation will run for about 30 minutes, and then we'll use the rest of our time to address your questions live. We encourage you to please use the questions function in your console to submit a question privately to our team at any time. We'll address as many questions as we can within the time allowed, and we'll certainly follow up with you directly afterwards if we can't get to all the questions. If you have any technical issues during the event, please also use the same questions box to chat for support. Finally, today's session is being recorded, and this will be sent via email along with the presentation and handout materials in case you want to revisit the session or perhaps share with your colleagues. So with that, I'm going to hand over to Alex to help us get started in thinking about how telemedicine is here to stay and what that means for you. Alex?
Great. Thanks, Patty, for that introduction. I'm going to pop our videos off so we can get started on the presentation. So again, just want to thank everyone for joining us today so we can talk about our perspective on this incredibly interesting topic, telemedicine in the post-COVID-19 landscape. So, as we all know, COVID-19 has greatly impacted the process of healthcare provision, turning medical visits that were once widely done in person into a completely virtual experience for both physicians and patients. Telemedicine, which was slowly gaining traction in the U.S. healthcare system, saw a surge in utilization as providers scrambled to keep their offices and healthcare facilities open as state lockdowns ensued. The concept of medical visits changed almost overnight. Global Ipsos studies conducted earlier in 2020 and recent interviews with key healthcare stakeholders both indicate that telemedicine is here to stay. But the critical question becomes, in what way? Will it find a niche role in certain areas in the post-COVID landscape where it can be as effective as in-person visits? Or will barriers, whether regulatory or operational, be too significant to overcome for telemedicine to persist long-term? First, let's set the scene for telemedicine utilization in the pre-COVID environment. According to Ipsos's COVID-19 surveillance report, conducted in April of this year, only 10% of HCPs had seen patients via telemedicine before COVID. Our recent discussion with key opinion leaders echoed similar pre-pandemic utilization, indicating that telemedicine did not play a significant role in the majority of physician practices and hospitals. While a few of these physicians claimed to not use any virtual visits prior to COVID, the majority reported that telemedicine was seeing increasing adoption in the past 5 years. Virtual visits were particularly growing in rural or remote areas or in specific situations where patients faced issues regarding transportation and other access challenges. In the Ipsos Digital Doctor 2020 survey, physicians reported that prior to COVID, only 2% of total patient appointments in the U.S. were conducted via telemedicine. Overall, Ipsos research depicts telemedicine in the pre-pandemic landscape as a medium that was present but not commonly utilized in the healthcare sphere outside of specific cases. This dynamic was captured succinctly by a product director at a national payer organization. Prior to COVID-19, we still believed that there was much greater potential that was untapped within telemedicine to be able to provide more and more services in that kind of delivery setting, and that it was still somewhat increasing in sort of a very linear and predictable way, but not necessarily taking off. Though it was overall limited in use, there were some drivers of telemedicine in the pre-COVID environment. The top driver was improved patient access to care. For patients living in remote or rural areas, telemedicine provided a convenient means to receive care without traveling long distances, particularly for those who needed regular follow-up visits related to chronic conditions. In the same vein, telemedicine also enhanced access to care for patients with mobility issues, such as back pain, as well as for individuals from lower socioeconomic backgrounds facing transportation or financial restrictions. This improved access was particularly important for patients looking for specialty care and mental health services, as geographic and mobility limitations severely impeded their ability to seek the care they needed. In addition to increased access, another significant driver for telemedicine utilization pre-pandemic was that it contributed to a more efficient use of time for physicians. Telemedicine was a great option for certain visits that didn't need the personal contact or diagnostic capabilities of an in-office visit. For these cases, conducting visits virtually removes the burden of the normal in-person case and load for physician offices. And not only did telemedicine allow in-person volumes to be better controlled, but it also enabled physicians to offer medical visits and services outside of normal clinic hours. This flexibility in timing for physicians allowed for an additional income stream for practices interested in generating revenue outside of their regular brick-and-mortar visits. However, the pre-pandemic environment was also fraught with telemedicine barriers, the most significant being the uncertainty around reimbursement of virtual care visits. Reimbursement levels for telemedicine visits were nowhere close to those for in-person visits in the beginning of 2020, with physicians indicating reimbursement rates either lacking entirely or at 25% of standard in-person rates. There are similar concerns around billing for visits done over the phone, both in terms of insurance coding and collecting patients' contributions. The situation underscored physicians' willingness to provide value-added services to patients outside of conventional in-person settings, but to do so, having to overcome barriers in both administration and payment. These frustrations were captured in a recent conversation with KOLs, with one dermatologist giving us the quote you see now. You're putting a lot of time and effort into doing this, and if you can't get reimbursed for it, then you ask yourself, what's the point of doing it in the first place? I'll just bring them into the office where there's a structured way of getting reimbursed. Aside from these reimbursement struggles in the pre-COVID landscape, general apprehension toward using telemedicine arose from physicians' concerns around clinical appropriateness. In the pre-pandemic environment, many physicians believed that telemedicine was not a viable option for patients who needed high-touch, close-contact care. For example, internal medicine physicians felt that in-person environment was necessary when diagnosing their patients to have a comprehensive examination. Additional barriers stemmed from difficulties integrating telemedicine into the practice workflow. On top of the need for EMR integration, practices had concerns around the extra burden of adjusting operations to include virtual visits as part of their service offering, such as training staff on telemedicine procedures and coordinating scheduling with in-person visits. Physicians also cited cost barriers due to the upfront investment in web platforms and subsequent subscriptions. Increased telemedicine usage would also likely necessitate a revamp of the practice's IT department, which may not have been designed with telemedicine utilization in mind. Finally, due to the nature of virtual visits, technological failure was an inevitable barrier in most practices before COVID. These challenges revolved around lack of proper tech equipment or internet access, as well as difficulties in ensuring less tech-savvy patients were able to navigate telemedicine platforms. As coronavirus cases began surging in the U.S. in March, causing a national public health emergency and lockdowns across the country, physicians had to adapt to their practices to consider social distancing measures. HCPs reported decreased in-office patient volumes and a significant increase in telemedicine visits once COVID hit, with telemedicine becoming 100% of patient visits in some practices. Since then, as practices have adjusted to the new requirements for care delivery, telemedicine has settled to a level that is significantly higher than pre-COVID, creating an operational middle ground that varies by practice and specialty. We all know how impactful COVID has been in our day-to-day lives, and the quote you see here from a national payer really encapsulates how the pandemic affected providers' use of telemedicine. Telemedicine utilization just absolutely skyrocketed. It was highly encouraged that people start with a virtual visit, a telemedicine visit, to do that first before attempting brick-and-mortar care for their own safety as well as the safety of others. Pre-COVID barriers had to be dealt with to support this increase in telemedicine, the largest being that the reimbursement rates for virtual care visits were not economically viable for most practices. But that all changed in March of this year, as CMS began expanding coverage of telemedicine services. This included allowing providers to conduct telemedicine visits with patients outside of designated rural areas, practice remote care across state lines, and bill for video and audio appointments at parity with in-person visits. Changes to coding structure were critical in enabling providers to have more comprehensive billing for telemedicine services than in the pre-COVID environment. Furthermore, CMS temporarily expanded the scope of covered telemedicine services to include emergency department visits, initial nursing facility and discharge visits, home visits, and therapy services. These expansions in Medicare had a ripple effect, as they were mirrored by commercial insurance providers. enabling physicians to transition to telemedicine for the majority of their patient visits. Physician sentiment on these changes is captured here. It was good when we heard that the feds were on board with Medicare to allow for telemedicine, and I commend Medicare to CMS for making that happen, because really it would have been the death of the small practices. When CMS said, okay, look, we'll pay at par for telemedicine visits, and then Blue Cross, which is the other leading insurance provider for my era, said, okay, we'll do it. Every insurer came on board and said, we'll just pay you the same rate. You just keep practicing medicine, keep these people alive, and do it. In this new telemedicine-led environment, practices uncovered additional benefits to appropriately utilizing virtual care services. Doctors have cited the increased flexibility for both providers and patients as a major bonus. Providers can now fit telemedicine visits into existing schedule gaps or have them outside of their normal working hours, while patients did not need to have to take time off work or pay for childcare to talk to their doctor. With the surge in telemedicine usage, healthcare facilities also learned to become more efficient in the way their virtual care visits operated. Training for providers and patients was mentioned as a critical factor in acclimating to the COVID new normal. Physicians benefited from trainings around vendor platforms, and patients were educated on signing up and using the platforms during visits. As operations became more reliant on technology and telemedicine platforms, one physician noted the important roles of IT and compliance teams. Some physicians reported that their offices met as a group to educate staff on new billing codes and coordinate scheduling by discussing appropriate time allocation and staffing requirements for virtual visits. Through this improved understanding of the nuances of telemedicine, practices streamlined their virtual care operations and integrated them into their practice workflow. From this, the efficiency of in-person visits also increased. Not only has it reduced in-office patient load, but pre-screening patients over the phone eliminates some of the redundancies for normal office visits. This has led to doctors having more time per patient during in-office visits and fewer instances of consulting patients on complaints outside of their medical specialty. COVID has also brought about greater awareness and familiarity with telemedicine. According to a recently published Amwell survey, only 8% of patients had used such a service in the pre-pandemic environment. The increased promotion of virtual care saw that percentage surge to 22%, a dramatic increase that could represent long-term cost savings to both patients, health systems, and insurance providers. Finally, telemedicine in the COVID environment was used, in many cases, as a replacement to urgent care. This reduced the burden on doctors and hospitals, who were more readily available for inpatient treatment on patients who needed serious acute care. This also acts as a cost-saving mechanism for health systems, as utilizing virtual care services can be much less costly for the system than an ER visit or hospitalization that are often used in place of urgent care. Now, despite addressing the leading pre-COVID issue in telemedicine utilization, some barriers remain for providers employing virtual care during the pandemic. For one, technological barriers, especially concerning older patients. Those that are not computer literate are often restricted to regular phone calls, which do not provide nearly the level of patient insight as a video call. There is an additional need for providers to educate patients on how to use the technology, which often occurs the day prior to the actual appointment with the physician and can detract from the other operational efficiency gains of telemedicine. There's also the matter of determining the appropriate situations in which telemedicine can be used and educating patients on these use cases. Practices first had to identify what sort of clinical services could be offered by telemedicine, with most physicians agreeing that non-serious acute and chronic care were the most broadly applicable situations. However, patients did not necessarily know of the limitations of telemedicine, given that so many patients did not utilize these services in the pre-pandemic environment. Physicians had to discuss with patients how more serious ailments or diagnoses necessitated in-person visits, despite the benefits of video technology. And lastly, while some providers have been able to overcome the payment issues they faced at the onset of COVID, many are still having trouble with the intricacies of billing for telemedicine visits. Some doctors have cited differences in CMS codes for video versus audio calls, and how that can become even more complicated when patients are unable to access the video link for technological reasons. I'll now turn it over to my colleague Nimit to discuss the post-COVID telemedicine landscape.
Thanks, Alex. So this next section of our webinar will focus on the future of telemedicine and, importantly, the considerations for you as a manufacturer. We will look to see how health systems will evolve following this turbulent time in which the established care delivery infrastructure has been upended. What will be the lasting impact of the increase in telemedicine services that we saw during the pandemic? We believe a variety of factors will help drive long-term utilization of telemedicine moving forward. First, it is clear that telemedicine allows for improved access to care, both from a patient and from a physician perspective. Patients have told us that they've seen a great benefit in conducting virtual care appointments from the comfort of their home and at a time that is convenient for them. Similarly, physicians have been able to see more patients in the same time frame, and this has been due to the logistical efficiencies of telemedicine appointments. So kind of combining those two perspectives shows how much telemedicine has impacted access across the healthcare continuum. Physicians have also developed improvements in practice efficiency and flexibility through telemedicine. By gaining experience in how best to utilize telemedicine in their practice, HCPs are now well suited for deploying virtual care services in conjunction with their in-person appointments. In doing so, practices have also developed an operational, what we'd call middle ground, in which telemedicine can be successfully deployed around inpatient visits, a barrier that was hindering pre-COVID adoption. An overwhelming majority of stakeholders agree that if nothing else, this mere option of having an alternative to inpatient visits will continue to drive usage in the future. Physician practices have also overcome the one-time barriers of developing the technology infrastructure and operational know-how of utilizing telemedicine. Most, if not all, staff are now trained on the nuances of telemedicine use and are available to see patients through virtual visits by expanding their IT equipment and enrollment in telemedicine platforms. What I'd also say is there's a cost perspective to this. So while in a non-COVID world, a practice may have never expanded into virtual care services, they're doing so now. Given that it's a necessity for operating in this pandemic, all practices are now prepared to utilize telemedicine moving forward. The increased utilization in telemedicine throughout the pandemic has also allowed physicians to develop an understanding of which services are appropriate for virtual care and which require an in-person visit. This will enable doctors to be efficient and targeted in their post-COVID telemedicine deployment, only utilizing it in cases where it makes sense for them in their practice. From our expert interviews, some of the main uses that we heard for telemedicine in the future include chronic care checkups, post-surgery follow-ups, and urgent care cases, just to name a few. Finally, telemedicine gives physicians the ability to expand their practice by offering telemedicine services outside of traditional office hours or fitting it into their typical workday and reserving their inpatient time for when patients absolutely need it. This can represent a significant additional revenue stream for physicians who are willing to integrate telemedicine into their service offering. So now let's think about some of the potential barriers moving forward. According to KOLs, the biggest one was reimbursement. What they said was reimbursement will play the biggest role in the longevity of increased telemedicine usage. If, or more likely when, payers stop reimbursing telemedicine services at parity to in-person visits, we think there'll be a sharp decline in its utilization. Despite the impressive strides in telemedicine technology and operational efficiency, the financial incentives will still trump all, and they appear to be the most important in directing provider behavior. Practices will struggle to devote too much time to virtual care if it's only reimbursed at 30 to 40% of in-office rates. And KOLs believe this regression in reimbursement could shift telemedicine back closer to pre-COVID levels. Another barrier is the regulatory environment. So currently doctors can deliver virtual care across state lines after regulatory adjustments were made at the onset of COVID. This is especially important as so many patients are relocating to cope with the pandemic. So reestablishing the previous interstate practicing regulations would severely hinder the use of telemedicine. What we'd say is that there's no consensus among physicians on how this regulatory side of telemedicine will progress, but it stands to play a major role and worth watching in the future. The final barrier is that of human connection. So this notion of human connection, it'll remain a significant barrier for telemedicine usage moving forward. Reimbursement and regulation can shift and adapt with the support of key stakeholders, but doctors will have difficulty creating the same atmosphere of an in-person appointment while interacting virtually with a patient. This concerns not only the social aspect of the visit, but also the accuracy of diagnosis and the physician's ability to read into the patient's emotional state, both of which impact treatment decisions. This issue could be compounded further by continued technological issues, both on the side of the patients and physicians. This idea of human connection is also a two-way street. Through our research, we know that many patients will prefer to see their physicians face-to-face for the same reason. So in analyzing the drivers and barriers for telemedicine in the post-COVID landscape, it becomes clear that while telemedicine is here to stay, it will not sustain the usage that we've seen during the pandemic. The industry will find a happy medium, somewhere between pre-COVID and during COVID levels. Physicians will find areas where telemedicine can act as a facsimile to traditional in-person care, in instances like management of stable chronic patients and for patients with conditions that may limit their mobility. Through these sorts of use cases, physician KOLs anticipate that the post-COVID telemedicine utilization will represent between 15 to 20% of all patient visits in most practices. Now, if you remember, this is a huge jump from where we were pre-COVID. As we mentioned earlier, our data reported that only 2% of patient visits were conducted via telemedicine prior to COVID-19. We have a quote here from a practicing cardiologist sharing her thoughts on the future of telemedicine. I can see that telemedicine will be a bigger part of our practice now because the patient sees the benefit of telemedicine, and I think physicians do see benefits too. Patients will be more satisfied because they could get taken care of in multiple different ways, whereas I think before they really hadn't entertained being taken care of via telemedicine. But in the end of the day, it's really getting appropriately reimbursed for these services. We believe that telemedicine will have a lasting power far beyond a pandemic. But what does that mean for pharmaceutical and medical device manufacturers moving forward? How can industry stakeholders modify or enhance their value proposition to be best positioned for long-term success? So let's start with the patient perspective as that first stakeholder. The traditional patient journey needs to be updated. Let's think about a hypothetical journey for patients dealing with cardiovascular disease and how the changing telemedicine landscape impacts both patients and physicians. Here are a couple of examples of how and where things could change. So thinking about that patient journey and thinking about cardiology, one of the key trigger points in that journey is diagnosis. Telemedicine will now be utilized more frequently to respond to specific cardiac events and hopefully help in treatment at the early stages of the condition. Another intervention point is ongoing condition management. So the goal here is to ensure timely management of conditions at regular intervals and the reconsideration of treatment decisions as conditions evolve over time. The increased HCP patient interaction provided by telemedicine drives better monitoring of condition progression and treatment efficacy. So as you review your brand's patient journey, here's some questions to consider. How does telemedicine impact how your patient deals with their conditions, the way they seek product information, their relationship with their physician, and how they choose sites of care? Where within the journey are the key intervention points, the moments that matter? And where can you provide unique and meaningful value to the consumer? More than ever, patients are taking control of their health, and through telemedicine, manufacturers can develop innovative ways to improve their digital strategy and enhance patient engagement. In particular, companies should ensure existing patient support systems can be engaged with digitally and that providers are appropriately directing patients to these resources. These measures allow patients to better understand their treatment and can greatly increase compliance. Telemedicine also allows for improved data capturing to drive treatment decisions, both at a patient-specific level and more broadly at a population health level. Patients are increasingly willing to share medical data with manufacturers to improve outcomes. What sorts of initiatives could be developed to leverage patient contribution in telemedicine? Think strategically and empathetically about how you use this new information to develop a more trusted relationship with your patients. The second stakeholder we want to talk about is providers. Telemedicine usage will affect manufacturers' relationships with providers. How can you support the HCP community as they use telemedicine more in their practice? While compliance must be considered, industry stakeholders should ensure that provider partners and their patients feel supported. This can manifest itself in a variety of ways, from teaching HCPs how to help patients utilize support programs to educating providers on appropriate usage and administration of their products over a digital medium. Already, companies and brands are creating digital materials and interactive experiences for physicians to share with patients during remote visits. Ask yourself, what marketing and educational materials make sense for you and your brands? Finally, we need to think internally and think about the product as well. Telemedicine will play a role in your product story. Because the telemedicine platform reduces the barrier to provider-patient interactions, it'll improve access to treatments. The more frequent and immediate interaction can also help tackle a key barrier to product adherence, which is patient forgetfulness. How can you use the telemedicine platform to better communicate your product's message and reinforce its use case? Telemedicine does not mean that you necessarily need to change your product's positioning or message. What it does mean is that you probably need different tools to get that message across using more succinct and interactive methods than ever before. In summary, manufacturers need to have a proactive strategy on how to leverage the growing use of telemedicine. A strategy that clearly considers your patient's journeys, relationship with your providers, and your product's message. New thinking is needed in all of these areas. Patients are taking health into their own hands. They're sharing personal information more readily. They are more technologically savvy, and they're looking for product education and support at home. HCPs are looking for tools that are digital ready to help them communicate and educate their patients during telemedicine visits. All of these conditions and behaviors will lead to new business questions that need answers. Importantly, manufacturers should not think of telemedicine in a silo. It must be considered as a component of their overall digital and connected health strategy. As we move into this new hybrid care model with telemedicine and in-person visits acting synergistically, the hope is that patient outcomes will be optimized. I want to close with a quote from one of the KOLs we spoke to, who eloquently, and I think accurately said, "The blockbuster drug of the 21st century is the engaged patient." We want to thank you for taking the time to listen and participate in this webinar. And we're going to now create some time and then open it up to questions.
Right. Thank you, Alex and Nimit, for that great content. We're now going to open up for discussion and answer your questions. I'm going to come back on video now so that you can see us as we go through those. We'll start with the questions that we already have, which are great. Please use the questions function in your control panel to submit any further questions or follow-up questions. And again, those that we can't get to, we'll respond to you by email. So our first question that I'm seeing is, how will telemedicine impact specialty practices differently compared to primary care physicians?
I'll take that one, and that's a great question. So, I think, first off, the difference between specialty and PCPs may not be as great as we think. Through our research, we talked to a variety of specialty groups. We talked to endocrinologists, dermatologists, cardiologists, and we also talked to PCPs. And, the first thing they said is they see the utility in telemedicine moving forward. So I think that's kind of a good starting point. I'd say the second thing is to think about specialty areas where they are utilizing what I'd say is kind of the broader telehealth area. And what I mean by that is that they are gathering patient data using telehealth. And an example of that is the endocrinologist that we talked to. So their patients are using continuous glucose monitoring. And the ability for them to take that data and then integrate it with telemedicine or virtual visits was really, really important to them. And that was something they mentioned to us. And so I can see that in specialty areas where they are already utilizing data integration and data gathering, you're going to see some increased use of telemedicine, and they're going to see the utility of it. But the other thing I would say is that even in some specialty groups where we may not have thought that telemedicine was going to be used as much as maybe other groups, we were surprised by what we heard from some of our interviews and some of our conversations. So the dermatologist is a great example of that. And for him, it came really more down to kind of where in the care continuum his patients were. So, what he told us was, obviously for a first visit, when he's doing an initial diagnosis, he would rather that be in person. But when he's thinking about more continuous care, his checkups with his patients to understand if the treatments are working and to understand kind of where they are in terms of their condition progression, he really saw telemedicine as a great vehicle for that. So I think more than just thinking about specialty versus PCP, I think we also need to think about where that patient is in their care continuum.
Awesome, thank you. And then are there any specific patient populations we'd like to know that would be more impacted by increased telemed usage?
Yeah, I can take that one. So in talking to HCPs, they definitely do think that there are going to be some populations that are drawn to telemedicine and others that are kind of scared of it and don't want to adopt it, right? I think we've already talked about this a bit in the pre-pandemic environment, but we were seeing a lot of utilization in remote areas, in rural areas, in patients with mobility issues. And there's no reason to think that if the reimbursement and regulatory issues that have been addressed, if those trends continue moving forward, then those patient populations will likely see an even further increased use of telemedicine. And then looking at other populations, I think it's very similar to technology trends in general, right? Where younger, more tech literate, tech savvy people are going to be okay with adopting this disruptive platform, this disruptive product. Like if you think, for example, of patients or parents who have kids and are trying to fit their pediatric appointments into their busy work schedules, it's much more convenient for them to just do a telemedicine visit rather than schedule their whole workday around an in-office pediatric visit, right? And so I think you can see a lot of utilization in those sorts of populations. And then on the flip side, like I said, like other tech trends, older patients, less tech savvy patients, they're not going to want to use it because they're comfortable in the ways that they are receiving care currently, and they don't see a reason to upend that, right? But there's always potential for I think our senior populations are already starting to become more tech savvy than they were even a few years ago. So moving forward, who knows, as the general population ages and tech savviness ages into the senior group, I think there's definitely potential for those older patients to really use telemedicine because they do have those mobility issues that we were discussing earlier.
Where do you see, thinking about these changes, the biggest areas where companies need to rethink their brand marketing plans due to increased telemedicine use?
Yeah, I'll take that one. I think we could do a whole webinar on this topic, but I'll give a couple of considerations. One which we talked about earlier in the webinar, which is the patient journey. So I think every brand should be relooking, dusting off those patient journeys and really kind of looking at them with this new lens of a hybrid model. And there's a couple of specific areas, that we touched on that I think you got to look at. One is kind of early diagnosis, right? And so telemedicine has the ability to play a very important role in that. So that's one area, one inflection point I would look at. The other one is product adherence, right? So we talked a little bit about the fact that you're going to have the ability to have more frequent HCP and patient touch points. It really provides that ability to make sure that patients are on your product or on your drug and adhering to the way they should be using that product. So I think that's really important. A second consideration is thinking about, if you do have a DTC campaign or a direct-to-consumer platform, one way to even enhance that is really thinking about direct response, right? That's a more proactive strategy. And what that does is it allows you to have these really specific one-on-one conversations with your patients, and you're actually driving them to a more specific action. So instead of just asking patients to have a conversation with their physician when they see them in the office and asking them to talk about, ask about a product, you're really driving them to a telemedicine consult, which is happening. Patients are proactively having these telemedicine consultations, right? And so you can use direct response to do that. And I think that's something that should be considered, and see if it's appropriate for your brand. And then the final one is tactics. We touched on this again, but I do think that with telemedicine, there's more and more ways to get your message out to patients. And so that could be digitally savvy or digitally engaged types of messages that you give to your HCPs so that they can utilize them when they are having these virtual visits with patients. It could be, and we're seeing this in our research, actual virtual waiting rooms, right? So when a patient is waiting for their virtual visit to begin, that's another opportunity for you to place an ad or place a message about your product. So all of those, I think you can think about this both strategically and tactically, but I think there's a lot of ways to rethink your marketing plans because of telemedicine.
Slightly beyond the scope of the presentation, this one, but how do you foresee practices utilizing additional data feeds from telemedicine and telehealth, and how will these new data feeds be integrated into a smooth practice workflow?
Yeah, I can take that one. Yeah, I think this is a little bit out of the scope of this presentation, but so I think this is a question that really has been going on in healthcare for the past decade, really, right? Ever since we started generating a lot more patient data, a lot more personal data, and it's how are you going to consider all those potential data streams, right? I think we've already seen a lot of benefits on a population health level, on a macro level, where you can aggregate that data and look for trends. And then you definitely see it on a patient level when you're looking at tracking of patients with chronic conditions, seeing how their treatment progression is going, right? But I think the real question is how would someone who's not being monitored continuously, who's not on who doesn't have a chronic condition, how do you integrate the general data that you get from things like your wearables, your Fitbit, Apple Watches, right? Your smartphones, and potentially some remote health monitoring devices. Some patients might have those as well. And how can you make all of that data actionable for a physician and for a practice? Because I think a lot of that is kind of superfluous right now, right? And so I think at a practice level, and this is, again, out of the scope, but I think it's based on my prior knowledge of the space, I think likely the best that you can do at a practice level is looking at all of your patients' data, trying to aggregate it, looking for trends and outcomes amongst your specific patients, and trying to develop potential case management, disease management programs suitable for you and your patient populations. And I think that is happening, but it's not, if a practice isn't already doing that data aggregation and developing those tools, then a patient coming in with their data isn't going to be very helpful. But, there's a whole potential reasons of where it could be implemented and why, and I'd be very interested in talking to physicians about that. But it's just a little bit out of the scope of our conversations for this initiative.
Maybe a future study there on that one.
Yeah.
So as we look to the future, what specific therapy areas do you see telemed playing the biggest role in?
Okay, I'll take this one. This is somewhat similar to that question around specialty groups. I think that there's going to be a lot of therapeutic areas where telemedicine plays a role, but I'll give just a couple of considerations. The first, and Alex just mentioned this, is the whole idea of where kind of chronic care management plays an important role. So, a couple specific examples of that are HIV patients, diabetes is another example of that. So, any therapeutic area where you do need frequent check-ins and checkups to understand how that care is going and how the condition is progressing, I think plays really, really well to telemedicine visits. So that's one. The other area I can think of, and this is probably not surprising, is in areas where behavioral or mental health plays an important role. So, in those areas, what we've seen through our research is that being able to do a virtual visit and having those conversations between the physician and the patient is almost the same, if not the same, as an in-person visit, right? So they can have those conversations just as well via telemedicine. And so I think those are two, specific therapeutic areas that I would look towards that will have probably an increased role in telemedicine moving forward.
Great. And then looking at, will the increase in telemedicine have any direct impact on patient outcomes, in your opinion?
I'll take that one. I think that's, it's a great question and really necessitates long-term studies looking at patient outcomes, right? And it's likely that those studies are already ongoing, and we'll probably start to see publications in the next couple years that talk to how were general patient outcomes impacted by such an increase in virtual care that we had during the pandemic, right? And those will be very interesting. But just talking my own theories and some anecdotes from our conversations with key opinion leaders, they don't foresee telemedicine having any negative impact. They wouldn't speak necessarily to the positive impacts, but they think that they have a good enough knowledge base of where telemedicine can and can't be deployed such that they would never use it when they shouldn't be using it, right? So if a patient needed to come in and get treatment in person or needed to come in and get a diagnosis in person, physicians would make sure that happens. They would never try to substitute telemedicine if it didn't work. So they don't foresee it having any negative impact. It'll only be used where it's appropriate, shouldn't impact those outcomes. But then in terms of potential positive impacts, and we talked about this during the study, or during our presentation, but there are studies that show increased HCP patient interactions and touch points can drive improved adherence, and improved adherence can result in improved outcomes, right? And I think it's pretty clear to connect the dots between telemedicine and increased HCP patient touch points, right? It's a lot easier to get a hold of your physician and have a quick appointment with them via telemedicine than the in-person care. So and again, just theorizing here, but potentially more HCP patient touch points enabled by telemedicine results in improved adherence, can therefore result in improved outcomes. I think it's pretty easy to connect those dots, but like I said, really you'll have to look at long-term studies, which I'm sure are being started right now.
Yeah, that'll definitely be really interesting data to see at those long-term studies coming out. So thank you, everyone. In the spirit of ending this on time, maybe giving people back a little bit of time, we'll now conclude this session. We really appreciate you sharing part of your day with us, and we hope you found this session valuable for your planning. As we mentioned, a recording of the webinar will be shared shortly via email, and please see the handout section in your console for information on our telemedicine expertise. Of course, we welcome the opportunity to personally speak with you about answering your questions or adjusting your strategies for the next era of telemedicine. So feel free to reach out to Alex or Nimit or any ITSOS contact directly. Thank you all, and have a great rest of your day.
Thank you.